Breast cancer is one of the most common types of cancer in women. That's according to the American Cancer Society. Although there are several outside factors, doctors say genetics can also play a role. As part of our Ask the Expert series, 7 News' Kelsey O'Donnell spoke with a doctor from Bon Secours about breast cancer genetic testing.
About 1 in 8 women will be diagnosed with breast cancer in their lifetime.
You have cancer. It's a phrase most don't want to hear, and in recent years, health experts say it's become more common.
It's a very common misconception that all breast cancers are hereditary. In fact, the majority of breast cancers we see are not inherited. Most of them actually are what we call sporadic, so they come up randomly in patients who maybe don't have a family history.
While doctors say the majority are not hereditary, they do see a number of breast cancer cases that are based on genetics.
There are actually several genes that can predispose women to breast cancer. We actually check in our clinic a panel of dozens of different genes looking for inherited predisposition to breast cancer.
Having a specific genealogy does not mean you're guaranteed to have cancer, according to doctors. They say it helps them predetermine a plan for testing or explore treatment options if cancer is found.
The main tests that we would do are what we call germline genetic testing. That's a test that we would do either of the blood or even of the saliva. We can do a cheek swab for DNA to look for genetic mutations that patients were born with.
If results return positive, doctors will then take a proactive approach, putting a plan in place.
So for a patient with breast cancer, the first step is to treat the breast cancer. We may use surgery, we may use chemotherapy or radiation therapy. But then we're going to take some steps to lower their risk of developing subsequent breast cancers.
Whether breast cancer runs in your family or not, medical experts say it's important to stay up to date on screenings and make sure you perform self-breast exams.
I think the most important thing in terms of inherited breast cancer is for women to know that the vast majority of breast cancers we see are not inherited. So just because you don't have a family history of breast cancer doesn't mean you should ignore something abnormal that you felt or that your physician has found.
For this week's Ask the Expert, I'm Kelsey O'Donnell.
Be sure to contact a physician if you have any concerns. Remember, you can submit a health topic for our Ask the Expert series. Just head to our website, click the News tab, then Ask the Expert.